All right, I'd like to welcome everybody to the webinar. Thank you for joining us. Give everybody a couple of minutes to get settled in and make sure that everything's working. In the meantime, I want to thank our sponsor. Next slide.
Come on. There it is.
I'll come back to that one. Go to the next one. Sorry. I think I sent those to you in the wrong order. Yeah. So I do want to thank our sponsor. We're being sponsored by the Viticus Group, who does Western Veterinary Conference. They were kind enough to sponsor several of our webinars this year. And we also have we have 6 hours of feline specific programming at Western coming up March 2nd through the 5th. So thank you to Viticus for sponsoring the webinars and this webinar as well. Now, I'm going to go ahead and I'm going to introduce our speaker. Mary and I have known each other since dirt, I don't know, very long time. Mary's a charter member of the Academy of Veterinary Dental Technicians and received her veterinary technician specialty in dentistry in June of 2006 and has recertified a couple of times since then. She worked in research for 31 years, specializing in products aimed specifically at the oral health of companion animals. And even though she doesn't specifically work in that anymore, she does still continue to collaborate with many companies to help them improve the efficacy of their products. In addition to her research background, she was a practice manager and dental technician specialist at a general practice for 7 years. She's an adjunct at 2 distance learning veterinary technology programs, and she is the owner and president of a company called Beyond the Crown Veterinary Education, which actually does remote training and in-person training for veterinary teams. You call her up and engage her, and she'll come in and teach your team everything you need to know about dentistry, right? She has over 17 years experience in teaching dentistry to veterinary teams and using practical and easy to master methods. Mary's actively involved in NAVTA, is it AVDT, AVMEA, the American Association of Veterinary Boards. I'm trying to think of all of these that you're in Kansas Vet Tech Association.
Yeah, basically, if there's an acronym in VetMed, I'm involved in it.
Yeah, and that's way to go. She was also honored with VMX or for the old ones here, NAVC for the VMX Technician Speaker of the Year for 2024. She was the NAVTA Veterinary Technician of the Year for 2020, and she received the AVDT's Excellence in Dentistry Education in 2019. In addition to being a speaker, she's also a wet lab instructor at numerous state and national conferences. She's written multiple articles. She has written a textbook and has also contributed chapters to other veterinary textbooks as well. So, wow. Yeah. We've known each other.
I'm tired now. Can I go to bed? I'm just kidding.
That's a lot. All right. So I'm going to turn it over to Mary, and I'm going to jump off of the web here. Please enter your questions in the Q&A feature, and we'll save some time at the end to come back and we'll go through some of those questions. So Mary, take it away.
All right. Thank you. I appreciate that introduction. I'm actually going to go off video here myself. I find it does work better because I get distracted looking at myself. So we're going to talk today, and I want to thank Viticus for sponsoring this webinar. We're going to talk about, feline dentistry. And, I kind of jokingly say cats don't read textbooks. And I always say cats are cats and they're going to do what they want to do. But we're going to kind of talk today about some of the things that are more prevalent in our cats. And we have to remember as veterinary professionals that they're not small dogs. They're their own species, and we're going to be looking at things a little bit differently in them. So when we look at a cat, we really need to know from the oral cavity standpoint what's normal. We need to know how many teeth they should have, and we need to know that there are some teeth that we are they don't have. I mean, we should have, I don't think you guys can see my cursor here, but we should have another premolar here if this was a dog. We should have two more premolars down here if this was a dog. But again, they don't have those teeth. So we just need to know how many they should have and what they should be shaped like in appearance. When we do chart, every animal who has a dental procedure should have a dental charting done. And a dental chart is just a diagrammatic representation of the dentition where we can make notes, okay, and what's happening in the mouth. Unfortunately, this can only be done under full general anesthesia because we have to use things like a periodontal probe that can be kind of sharp, and the cat just doesn't know to open wide and hold still. So we have to do this under general anesthesia. And when we're doing an oral exam, there's actually two exams that we do. And the first one is a conscious exam. And that's limited to both visual and digital, what we can see and feel on the face. And we want to look at their face and just see if their facial bones are, symmetrical. And then we're going to kind of feel their zygomatic arch or their cheekbone. We're going to open and close their mouth if we can and see if there's any clicking in the temporal mandibular joint. And then we're going to look to see and feel if there's any swelling in the salivary glands or lymph nodes. And this is the one time that we can really see how the teeth fit together or how their occlusion is. Because once I have an endotracheal tube in their mouth, I'm not going to be able to put their teeth together to see what the occlusion looks like. The next one we do is actually the anesthetized exam. And there's a lot of things involved in this exam, and a lot of them only take a few seconds. So once the patient is intubated, and while we're intubating that patient, we are looking at their oral pharynx. We're looking down the back of their throat to their trachea. Is there any abnormal swelling? Are their tonsils swollen up? Is there a mass that shouldn't be there? Or is the back of their mouth all inflamed? That gives us a chance to look for that. Once we have them intubated and on the anesthetic machine and hooked up to all the monitors and all the nice warming devices that we want to keep our patients on, we're going to then look inside the lips, the cheeks, the mucous membranes, look at their hard palate, and please always look under the tongue or at the floor of the mouth. In our cats, a lot of really bad things kind of like to live underneath the tongue. We even need to look at the tongue itself. Is there something going on in the tongue that shouldn't be happening? And then I look at the teeth. And it's kind of dorky, I know, but I think of each tooth as its own patient. Okay. So in a cat, we should have 30 teeth or 30 patients. And I know that sounds kind of crazy, but it helps me to remember that I need to look at each and every tooth in the mouth. When I do my oral exam, probably my favorite tool of all time is a periodontal probe. And this one that we see in the bigger screen blown up there is a UNC 15. This is by far my favorite probe of all the ones out there. I like it because it's super easy to read. It's every millimeter is marked and every 5 millimeter is a double mark. And it's indented so the coloring doesn't wash away or come off. And you can see it under a really bright light. So it's very easy to read. And, like on this picture, this is actually a cat's maxillary canine. I can easily look at that and tell you that that's a 9 millimeter pocket. So it doesn't take much for me to be able to look and easily see how deep a pocket is. And I use this for several things, not just for pocket. I'm going to use it to evaluate gingivitis health and maybe mobility in a tooth as well. The other end of my probe has an explorer, and the explorer is usually something we use very cautiously in veterinary medicine. Human medicine uses it a lot more frequently to see and feel if there's like any pits or fissures in our molars, if there's cavities forming. Um, in in veterinary medicine, I will use this to see if a fractured tooth, if the pulp is exposed. But this is very, very sharp, and I don't like to take it below the gum line because it will lacerate the gingival tissue. The only time I will use it kind of quote unquote below the gum line would be if that point is pointing to the enamel or the tooth, and I'm going to see if I feel anything like a roughness or something that could be associated with tooth resorption. We also need to note when we're charting what type of head type our animal has, because each of these head types kind of have their own, a little bit more problems dentally. Now, the mesiocephalics are medium breed cats, and I know I have domestic short hair, which is really not a true breed, but that's the majority of our cats, have the normal muzzle length muzzle. Our brachycephalics are the ones with kind of the little smushed in face. Those are going to be our Persians, and they have a lot of issues just because of crowding in our premolars. And it's just that overcrowdingness in there, it leads a nidus to infection for periodontal disease. Our Docleocephalics, our Siamese type cats, they really don't have a whole lot more problems than a mesiocephalic because the difference is not that great between the mesiocephalic and a Docleocephalic in cats versus what we see in a dog. When it comes to cats, it's important to know from a veterinary standpoint how many roots each tooth should have. And this is going to be important when we're, if we would have to do an extraction, and the veterinary team needs to know how many roots should be there. And when we look at this, all of my incisors and my canine, and even my second premolar, because cats do not have a maxillary premolar or first premolar, have one root. Then we have a two-rooted tooth. The only tooth in the mouth with three roots on a cat is going to be the maxillary fourth premolar, or O8. And then we have this little guy back here, a little tiny molar. I kind of sometimes refer to him as the appendix. He doesn't really do much. He's just kind of hanging out there. And then on the mandible, we have canines and incisors with one root. We don't have a first or second premolar, and the rest of our teeth all have two roots. But it's important to note that on that big molar in back, the first root, the mesial root, is going to have twice the distance compared to the back root. Okay, so when you're feeling, we're going to talk about feeling for frications. If you felt something up in here, that's not a frication. The frication is going to be on the back third of the width of that tooth. Make sure we count the number of teeth. We want to make sure we don't have deciduous teeth in place. And if we have deciduous teeth, we need to have them removed. We don't really want to wait for them to become loose because if they don't become loose, they can be an area that's going to not only potentially lead to overcrowding and periodontal disease, but they can actually lead to malocclusions by forcing the permanent tooth into the wrong spot. We have a saying in veterinary dentistry that no two teeth occupy the same location. Well, I actually heard an analogy about a year or so ago that made me really think that's what I need to tell people. It's like no two people wear the same turtleneck. And if you kind of think about that, that's what we're doing. We're really stretching that gingiva around that area, and it can lead to some severe problems for that patient down the road. If we have too many teeth, sometimes it's okay if it's not causing any issue, but if it is causing an issue, it would need to be removed. But anytime in our patients that we have a missing tooth, we need to definitely take a radiograph of that and document it on the dental chart. Now, oops, sorry. When we look at some of the things I look at when I'm charting, I am going to look at plaque. I know we're going to be removing it, but plaque is the problem child for our patients. Okay, that is the gelatinous matrix of bacteria and bacterial byproducts. It is what is actually the cause of periodontal disease, the cause of gingivitis, those types of things is coming from the plaque. And it's usually very hard to see. It's light clear, sometimes light yellow. And we might need to use a disclosing solution to see it. Like when we were in elementary school and we were going through, or dental health, and, we'd brush our teeth and then we'd chew that little red tablet to see what we missed. Yeah, the cats aren't going to chew the tablet, but we do have that in liquid form. However, it can be messy and the cat might go home with some stained gingiva. and we may not, or stained fur, and we might not want that to happen. But another thing we can use that works excellently is a black light. And you can buy little tiny flashlights that are black lights and use them in the exam room with your clients to highlight the teeth. You know, you lift the lip and you go ahead and disclose it. The plaque and calculus will show bright pink under a black light. So it is kind of impressive when you see that, but it is a great tool not only for the diagnosis and looking at plaque, but also following a dental cleaning. Once we've scaled, we want to double check and make sure that we've gotten everything off the teeth. When we count those number of teeth, I keep going backwards, sorry. There we go. Now we're going to talk about calculus, and calculus in layman's terms is tartar, but the official name for it is calculus. Okay, it's not a hard math class. That's why we don't use it in front of our clients, because they might think, oh my God, I don't want to take calculus again. But it's calcified plaque. And one thing I didn't mention with the plaque is that plaque really starts to form on the tooth about 20 minutes after a cleaning. Okay, it'll start laying down the first biofilm. And that biofilm and plaque, if not removed, every 48 to 72 hours, it will calcify. And when it calcifies, it becomes this rough, kind of ugly substance on the tooth. Now, it's not going to brush off, guys. You can't really get it off. You're going to have to use a power scaler or a hand scaler to get this off. But in itself, it doesn't cause any problems other than more surface area for more plaque. So we have to kind of keep that in mind. I always think of it as kind of coral in the ocean. And cats don't usually get a whole buildup of calculus. The picture you see there is kind of an anomaly that we see that much calculus on a cat's tooth. Now you will want to record, I record both the plaque and the calculus. You don't have to record it per tooth if you don't like to, but I can just, kind of give it an overall score, overall mouse score, so that I can kind of say, okay, here is, this animal, and we're going to call this about a medium plaque producer or medium calculus producer. And the reason I want to give that score is that when I'm determining what we want to talk about for home care for that pet, I have a better idea. I'm going to be more aggressive with a heavy plaque producer or heavy calculus producer than I am going to be with a light. Gingivitis, the gingival index to me is one of the more important things we want to look at. I always will chart before, I'm going to do x-rays first or radiographs first, and then I'm going to chart the mouth before I clean. And the reason I chart first is that I want to see what the gingival health is. And sometimes after a cleaning, the gingiva might be just a little traumatized and may not be giving us a realistic score. But when I do a gingival index, I'm going to take my periodontal probe and I'm going to insert it into the gingival sulcus. And then I'm just going to very gently glide it along. And I'm not putting any more pressure than I would with one finger on the top of my hand, just to barely indent the skin on my hand. It's very light pressure. And what I do is I will chart one quadrant or probe one quadrant of the mouth. And then I kind of look back at the teeth. And if the gingiva stays pink and healthy and looks great, you don't score it. And by the way, with charting, we only record abnormal findings. If the gingiva is red and swollen, but it doesn't bleed upon probing, that's a stage 1. If you've probed and you started at the back of the mouth and you end up on the third incisor and you glance back and your maxillary fourth premolar starts to bleed, that's a 2, because it's not immediate bleeding. And the ones that are the spontaneous bleeding, where you barely touch it with the periodontal probe and it starts bleeding, is a stage 3. Now you can give each tooth a gingivitis score, or you can go with the worst tooth in the mouth. Now, I'm kind of one of those people that like to multitask. So at the same time I am checking for gingivitis and I'm probing for that, I am going to probe for pocket depth. Now, some people will tell you to pick 4 spots or 5 spots, 6 spots around the tooth and probe. I am going to just kind of, while I'm moving that, gliding that probe along, I'm going to see if I fall into a pocket. Um, and I think it's less traumatic than to do a stair step where you're kind of going up and down, up and down, up and down, because we're just kind of gently gliding it along. If I fall into a periodontal pocket, I am going to record that pocket on my dental chart with a line to where it is on the tooth and then the number. So if it's, say, for instance, like this one, I said 9 millimeter, I would draw a line to the um, distal aspect of that canine tooth and write 9. Now you can write 9 pp for periodontal pocket if you like. A normal probe depth in a cat is about 1 millimeter. Anything over 1 millimeter, we have concerns. Okay, so we want to make sure that we are recording every periodontal pocket we find. And sometimes there's more than one pocket per tooth. You can have different depths around an entire tooth. We also get gingival recession secondary to periodontal disease where the tissue has just kind of eroded away a little bit. And this picture I'm showing you here right now, we would record that as gingival recession, but this has another name, and I'm going to get to that in a minute. But what with gingival recession, we record from the edge of the gingiva to what we call the CEJ, or the cemento enamel junction. And that's where the enamel on the crown meets the cementum that covers the root. And we measure that in millimeters. So we use our periodontal probe for that. And, you know, if I was doing this with a periodontal probe, I would look at this and say that's probably 3 GR. So we would GR3, which is 3 millimeters of gingival recession. Now, I'm going to get back to what that tooth actually had in a moment. I also look at touching each tooth, usually where the probe is kind of at the angle so that it's a little bit stiffer, and I just gently push on each tooth. If it doesn't move, we don't record it. If it's a 0.5 millimeter or less in one direction, I'm probably going to, maybe ask somebody else if they see it move, because it's a very minute little movement, but that's a stage 1. A millimeter or less in one direction is stage 2, and the ones that are kind of moving all over the place are stage 3s. We also need to assess furcation involvement. And a furcation is the area where a double-rooted tooth or a three-rooted tooth where the roots join. So what we would do with this, because most of the time when I've been probing, my probe has been parallel to the long axis of the jaw, or of the long axis of the tooth. Now I'm going to take my probe more perpendicular to the tooth. And just underneath that gum line, I am going to kind of rub my tooth or my probe back and forth to see if I can feel that notch between those two roots. If you don't feel it, no, you don't record it. A 1 is just like I can just barely feel a little bit of a notch. I always use my knuckles on my finger to kind of demonstrate. So I'm just barely feeling like I'm feeling between two knuckles. Now, a stage grade 2 is where I'm kind of in there. It's a little harder to go back and forth, but I don't pass completely through. And a stage 3 is one where my probe will go completely through from one side to the other. Now, when we've done this charting as a technician, this is a technician's job to do the charting. But after we've done that and we've taken the radiographs, the veterinarian is going to put those two things together to kind of come up with what's going to happen and what the diagnosis is. So we really want to look at loss of attachment in addition to the radiographs. And what we do is we're going to take a pocket depth plus gingival recession to come up with the loss of attachment. So for instance, on this one, we have this back molar, back molar back here. And I'm going to say we have 2 millimeters of gingival recession, but I have a 3 millimeter pocket. That means I have 5 millimeters of loss of attachment. That's over 50% of the length of that root. That tooth is going to go bye-bye, okay? Because it just becomes a nidus for infection if we don't let that tooth go. So when we look at periodontal disease, I, as a VTS and as a person who's been in dentistry my entire career, This is something that is so important for us to not only use to help create estimates in our practices, but also for scheduling our procedures. And um, excuse me, and get a drink here. So what I do with the estimates is in our practice, we had 4 prices for stages of periodontal disease. We had 4 for dogs and 4 for cats. And it was based on the degree of periodontal disease that was happening in the mouth upon our quick look at them beforehand. So, we kept our stage 1 and 2s pretty much as low as we could go financially because we wanted to encourage our clients to come in and have those COHATs, what we call a COHAT, which is a comprehensive oral health assessment and treatment, done before we got to the stage where we were going to have, extreme, you know, periodontal disease present. We also used them for scheduling because I wanted to make sure that if I scheduled a number 1, we still scheduled an hour, even though it might not take that long. But we wanted to make sure we had time in case we found something. And easily, sometimes a stage 3 or stage 4 periodontal disease, we would schedule for 3 hours just to make sure that we had the time to do what we needed to do for that patient. The other thing with using the stages of periodontal disease is it helps record the progression. The one thing that's really important to remember in this situation is I can reverse a stage 1. Okay. I can take a stage 1 back to stage 0. A stage 1, the teeth or the mouth just has gingivitis. I do not have any loss of attachment. I don't have any pocket depth. I'm not feeling any furcations. It is totally reversible back to stage 1 with a good dental cleaning and good home care. Stage 2, we have up to 25% loss of attachments. We're going to start feeling some of those grade 1 furcations. It's not reversible, but we don't have to let a stage 2 become a stage 3. Once we get to stage 3, we're in moderate periodontitis. We're going to have up to 49% loss of attachment, which in other words is 49% of that root is going to not have any attachment left anymore. We're going to start seeing those grade 2 furcations. And again, it's not reversible. And then of course, stage 4, we have over 50% loss of attachment. We're going to have stage 3 furcations. And a lot of times we're going to have mobile teeth in conjunction with the periodontal disease. A couple other things we see probably more in cats than other other species is gemination. And this is going to be when we have, we'll see it in both adult and baby teeth or deciduous teeth. It's where 2 teeth kind of merge. And why we're not 100% sure that happens. They may have 2 completely different crowns, but they share a root. Okay. They have a single pulp chamber. Now, the picture there on the right that's on the top, I got a feeling that's actually a supernumerary tooth. I don't have the x-rays to prove that, but I think that's actually 2 teeth that are overcrowded in there and we need to remove one. But the tooth on the bottom, that one that has kind of the weird little 2 crowns, that is a Gemini, okay? So we need to make sure we know what we're dealing with. And now, they don't always need to be removed. I'm going to tell you the one on the top, probably 1 or 2 of those need to come out because we are starting to see infection around those. But on the bottom, that tooth actually looks really healthy. And we just need to make a note and confirm with x-ray whether or not it's a Gemini tooth or not. There's just an x-ray of a Gemini tooth. Um, Everything is fine on it. It's not causing any issues, has 2 crowns basically, but they're sharing a center root. This one over here with the red arrow, this is something we see occasionally too, and it's not a supernumerary tooth, but it's a supernumerary root. That too should only have 1 root. And is it going to cause any issues? Probably not ever cause a problem. But you kind of need to know about that in case your doctor is going to do an extraction on that tooth. So sometimes it's just an incidental finding when we come through taking radiographs, but just be aware that we're going to see things kind of weird sometimes. One thing we see quite, well, not necessarily quite frequently, but we do see it often enough, is juvenile onset periodontitis. And this is going to happen to these kittens who are about 9 months of age. And it's going to be more common in some of our purebreds, as well as we'll see it in domestic short hairs. But what happens is we start at the time they start getting their permanent teeth eruption, they start to develop horrible malodor. Okay, and that's just bad breath. And then we get this really marked inflammation there just along the gingiva, and we get sometimes we even get some gingival enlargement, overgrowth of some of the tissues. And what we can do with these patients is a good cleaning early, good home care to keep that plaque at bay. And sometimes they actually will outgrow this. So it isn't necessarily a sentence that we have to remove those teeth, but we just want to make sure we're doing a good cleaning and home care, and hopefully the animal will outgrow this condition. We also get hyperplastic gingivitis. Again, that 6 to 8 month age, common in those Persians and Abyssinians again. But like I said, anybody can get it. This is going to be definitely an overgrowth of the gingival tissue. Again, cleaning every 3 to 6 months and possibly even a gingivectomy to go in and remove some of that overgrown tissue. And again, they may grow out of this as they mature. Now, tooth resorption is one of the things that I wish we could find a cure for. I wish I had some kind of involvement in it, because I think this is something that's bothered me for my entire career. And it has had 5 different names. We always joke that in veterinary medicine and veterinary dentistry, especially, don't get used to a name, because within 5 years it'll be changed. And this has had 5 different names in my career. But now we just call it tooth resorption. It used to be feline odontoclastic resorptive lesions. But we went to tooth resorption because we are seeing it more and more in dogs than we used to. Okay. And I don't think dogs are trying to become cats. It's just that we're taking more dental x-rays than we ever used to, and we're seeing it more frequently. When we look at tooth resorption, when we're looking at trying to figure out how do we chart this and what is the diagnosis going to be, is we have 5 stages, and that's based on the degree of involvement of the crown. Now, the type can only be done based on radiographic assessment, and the type is also going to help the veterinarian better understand how they can treat that tooth. By the way, there is no way of stopping this once it starts. Okay. We used to call them cat cavities, and filling it isn't going to stop, because it's almost like something happens on the inside of the tooth that starts to erode it away. Okay. So we don't really know what triggers it. I'm leaning towards autoimmune, but that's my personal theory. You rarely will see a stage 1 lesion, because they're usually just kind of right here below the gum line, starting in the cementum. Very difficult to detect. You might with a super great quality x-ray, but what you might see in the hospital is the patient is on the table and all of the gingiva is beautiful pink and just absolutely gorgeous. But there's one little tiny bright red spot on that gingiva, which is the body's way of saying, hey, look at me, something's going on below me. Pay attention here, something's happening, okay? But it's very hard to detect stage 1. Stage 2, back in my day, we would have probably referred to this as just an enamel defect. There's just a little bit of a difference there in the enamel starting to kind of erode away a little bit. But when we look at it, it's into the dentin. And when we get into the dentin of a tooth is made up of about 52,000 microtubules per square millimeter, and it communicates from the outside of the tooth to the pulp. And if you were to blow air on this cat, they would chatter. It's very painful, because now that is going directly to the pulp chamber. So these are painful at this point, but the pulp hasn't been exposed yet, but it is being communicated to through those dentin tubules. Stage 3, we are into the pulp, but the picture there on the top looks extremely painful to me. But what that bright red tissue is, that isn't the pulp, but that is the gingiva growing up and becoming a hyperplastic gingiva that is trying to protect the tooth. The body really wants to try to heal itself, So the gingiva is growing up to protect that tooth from the pain that it's feeling every time they eat or drink. Okay. These can spontaneously bleed when we probe them. They may fracture, but usually we're going to have a tooth fracture when we get to stage 4. And stage 4 was where the majority of the crown is gone. Okay, it has resorbed. And if you went to the ABDC website, you could find out that there are stage 4A through G. And it really depends on how much crown versus how much root is gone. I'm okay if you just call it a stage 4, okay? Because yeah, most of the crown is gone at this point. What we'll see sometimes with these patients when we're like, ooh, that looks really bad. Maybe we didn't see as much crown as I see on that top picture. I could take my finger and kind of rub it over that area. And if I feel a really technical term we refer to as little pokey outies, or a little bit of tooth there, we need to treat that at that point. Okay. Now, stage 5, not much we can do anymore. Stage 5, the lesion has, the root has replaced itself. The gingiva has healed over the top of it, and we have no tooth tissue that we can see anymore. And it usually seems to be this mandibular third premolars, kind of, I refer to that baby as my poster child for tooth resorption. But you'll get that little lump there. And if it looks like it does there, where it's pink and healthy gingiva, and there's no redness, no draining tract at all, even if I had a radiograph and I saw retained roots, we would not go after them. Okay. 5, 6, 10 years ago, if we saw retained roots, the rule was to go after them. But with we know now that why poke a sleeping bear? We shouldn't mess with it. It is not obviously causing any issue. There's no draining tracts. We can just kind of monitor that tooth and see what happens with that. Now that's for the crown. That's for the stages. Now we need to look at the types. And like I said, this involves a radiograph. And the type 1 lesions are probably the ones we used to see more commonly in dogs as well, but these are related to inflammation. Okay, so maybe the patient already has periodontal disease, which is related to inflammation, but the root actually appears pretty normal. And we're able to see the periodontal ligament space. We're kind of seeing that black line that goes around the root. When we see this, the recommended treatment is extraction. Okay. And not always a fun extraction, but we do need to extract those. A type 2, there's no root left. It has resorbed. It is ankylosed into the alveolar bone. There's nothing. I'm not seeing a periodontal ligament. I can barely make out where the root was. Okay. When we see these types of lesions, we can do what we call a crown amputation. And that means we're going to take a high-speed burr and we're going to actually cut a little bit of a gingival flap and remove this tissue here all the way up. We're just taking that crown off. And then we suture the tissue back over the top of it. And we're done. Okay. When you're taking these x-rays, you're kind of praying for type 2, guys. Okay. Because that's a lot easier to do than one of those extractions that we had on the previous page. And then, of course, again, cats are cats. And we get a, oops, my bad, a type 3. A type 3 is where we have one of each. Okay, so one root is a type 1 and one root's a type 2. So in this situation, that mesial root that we see the periodontal ligament around needs to be extracted. And then we can take our high-speed burr and just kind of burr off any of these, as a friend of mine calls them, little pokey outies, and then suture that tooth back, that gingiva back up over the top of them. Unfortunately, with tooth resorption, many times when a cat has one tooth with tooth resorption, they're going to have more. It is something that we will see kind of as a progressive thing. Going back to it, we really don't know what causes it. For a while, there was some theories about whether, it was vitamin D in diets and things. But we see these in wild animals who are not getting domestic food. And we see these evidenced in saber-toothed tiger skulls. And, so it's something that's been around for a long time. There's a colony of domestic cats. I'm going to use the domestic in quotes, off an island off of Australia. that these cats are never fed a commercial diet. They're out there to, they're feral, living on their own, and we see tooth resorption there too. So I don't think it's a diet issue. I think it is more a autoimmune issue with the cat themselves. People also get tooth resorption. Another thing we'll see in cats is those bulging or bulbous appearances over the maxillary canines. And this is now alveolar bone expansion. It used to be chronic alveolar osteitis. It is due to chronic inflammation and chronic infection. And the bone starts to change underneath that, underneath the gingiva. And that's what's creating that. It becomes very expansive. And that's causing that bulge that we see in the cats. This is an extreme case, but we want to biopsy that bone when we remove these teeth, and these teeth do need to be removed. Okay. And they need to be surgically removed with a flap and remove all of that necrotic bone that is around that tooth. Otherwise, that area will never heal. Now, this cat was Cleo. Cleo was a cat who had extreme disease that we tried to treat for many years before we finally were able to let the owner let us get that tooth out of there. In addition to the expansion, we get maxillary canine extrusion. And as I mentioned earlier, when I was talking about gingival recession, this truly isn't gingival recession, it is extrusion, because that bone change is causing the tooth to be pushed out of the socket, for lack of a better way to look at it. The teeth become longer, and they're going to traumatize the lower lip. And they are probably they need to be extracted. I keep forgetting to take my vital pulpectomy off of here, because what's happening is it's due to infection in the bone and the alveolar bone that surrounds that tooth. So these really do need to be extracted, and all of that necrotic tissue has to be removed as well. Sometimes we get discolored teeth, and yes, I know that's a dog tooth. It's hard to find a good cat discolored tooth. But if you have a discolored tooth in a cat, you have to determine whether it's intrinsic or extrinsic. Extrinsic means the stain's on the outside and I could polish it off. Intrinsic is revolving pulpitis. And for some reason, that tooth has been traumatized, and the pulp will bleed, and it bleeds into those microtubules of the dentin, and it causes it to bruise. And then about 89 to 90% of the teeth that are discolored are also non-vital. So treatment on these now is to either, we used to say watch them, monitor them, but most time it's going to be extract or do a root canal on them, because they're probably going to abscess at some point. Oops, I keep going backwards, sorry. Stomatitis. Oh boy, if I had, if I could cure this one, I'd be living in Aruba. Gingiva stomatitis. Again, I'm going towards the fact that it's an autoimmune issue. It is chronic. It is painful. You do want to rule out, feline leukemia and FIV. There are some studies out now linking it to caliciviruses. These animals are extremely painful. The gingiva around them is going to be bright red and cobblestone. There's also going to be inflammation in the back of the throat as well when we look at these cats that have gingival stomatitis. There are some treatments out there that, may help for a while, but realistically, the only thing that's going to be long-term help on this is a complete dental extractions. And that means that we need to make sure we're removing all of the dentin too, not just the tooth. There's a couple different schools of thought that the animal might be like allergic to its plaque. Yeah, that's probably plays a role into it, but I've had cases in our clinic where we had done full mouth extractions and the whole mouth healed up for but one area. And we had still had film at that time for our dental x-rays, and we didn't see anything, but we sent them to our specialist, and they had digital, and they were able to find a little tiny tooth fragment of a root that we didn't get out. And once they removed that root out, that area healed up. So it could be related to the dentin as well. That treatment is only 80% effective. Okay. That means 20% of our cats are still probably going to have inflammation after that full mouth extraction, and they may need to be on some type of a steroid off and on for the rest of their life. It may have an effect on their lifespan, but they're going to be much more comfortable because that mouth is no longer healing or no longer hurting. These cats are painful. There is no two ways around it. Nothing for me is more rewarding than a cat who has full mouth extractions, and we have blocked the entire mouth. And the first thing they do when they wake up is we offer them some slurred canned food, and they're eating like they haven't eaten in ages because it's the first time they've eaten without pain. This is stomatitis. This is a fairly advanced case of it. There's a caudomycositis back in the back of the throat. This is another type of stomatitis. We call this cheilitis. We used to call them rodent ulcers. I think this is kind of like for a human to think about this as being a cold sore. Okay. Very much like that on the lip. Oral nasal fistulas, yes, cats do get them. This is Annie. Annie was one of my patients that presented for chronic snotty nose. I know that's not a disease, but chronic rhinosinusitis. And we kept, the doctor's just like, well, let's flush your sinuses, let's flush your sinuses. And I'm like, can I look at the teeth? And I got told not everything involves the teeth, but okay. So this is actually the 4th year of us she comes in once a year to get her sinuses flushed. And I said, doc, there's pus here. This is pus. It's not good. And I lost a 15 millimeter periodontal probe there. Okay, that's significant. Now we did x-ray it. I don't have the x-rays, but they were basically no tooth or no bone around that tooth. And when that tooth was extracted, we had a fistula directly into her sinuses. So I felt so bad for Annie because she probably had an abscess brewing for 4 years, but it was showing as a sinus issue. The bottom line is when you have a cat who has chronic snotty nose or chronic nose issues, check the teeth. Is it related to that? There is not very much bone and much tissue between the cat's teeth and the sinuses. Tooth fractures, pulp fracture. The pulp in a cat actually extends basically all the way to the tip of the crown on a canine. So make sure that we are looking for that. Trauma will lead to the pulp chamber being exposed. Cats rarely will show signs of endodontic disease. They don't get like the fistula that blows out on the top of the face like we do in dogs, or the swelling. They will usually get a draining tract somewhere in their mouth that will cause that. When it comes to fractures, we have an enamel fracture, which is just basically like looking at an antique vase. There's little cracks underneath the line of the surface, but nothing we can feel. We also get uncomplicated crown fractures. An uncomplicated fracture is when there's no pulp exposed. A complicated fracture is we have pulp exposure, and we can have root fractures as well. That's just a draining tract fistula. We also get, I'll go back to that for just a second. I flashed through that kind of quick, sorry. We can also get dislocations, mandibular dislocations. The cat here, the black cat, has his jaw dislocated. But we also get jaw fractures, and we'll see fractures in cats. I've seen maxillary fractures and mandibular fractures in cats from trauma. A luxation means the tooth has been removed from the proper position, but it's still attached. An avulsion is one that we pick up off the floor. Technically, we could try to reimplant these by putting them back in the right location with an acrylic bridge. The success rate isn't great on doing that, but it's a try. That's a luxated tooth, cat trauma. It's just kind of hanging on by a thread there. Oral cancers, oral tumors, eosinophilic ulcers are going to be mostly common on the upper lip, but they can occur on the tongue too. Mostly these are going to be due to allergies. Again, do an incisal biopsy anytime there's a tumor. I always say if it looks good, it's probably bad. If it's bad, if it looks bad, it might not be. Squamous cell carcinoma, the most common tumor in cats, usually starts around 11 to 13 years of age. A lot of times they're under the tongue. Like I said, always check under the tongue. This one up here happens to be on the maxilla, but these animals are going to have facial swelling, asymmetrical faces, excessive salivation, not wanting to eat, and really, really bad breath. Same thing with a fibrosarcoma. They present exactly as a squamous cell, but more in the front of the face. That is not a tumor. Right here, guys, not a tumor. That is the lingual molar gland. It is supposed to be there. So be aware when you're looking at doing your oral exams, that's not a tumor. Odontomas, this tooth didn't erupt. An odontoma means odon is tooth, ulma is tumor. When we have an odon tumor, there's a ton of tooth particles inside that tumor. And this needed to be excised. This young cat actually lost half his jaw. It was a very aggressive odontoma. When we have missing teeth, we need to x-ray them, and they should be circled on the dental chart. Extra teeth, if you do extract a tooth, make sure you know what type of extraction it was and put an X through it. We do get cups, which is chronic ulcerative periodontal stomatitis. That has a new name now. And I'm sorry, I don't remember the new name, but it is basically where the tissue that hits the infected tooth or the plaque and calculus will become affected because of constant contact. All right, I am going to run through this because we are running out of time. So you saw him already. Oh, by the way, when we do those canines that have that bulging canines, that's just elevation. There's nothing else I've done to that bone. The doctor elevated it so you can see how necrotic that tissue is. Now I'm going to go past ACE. ACE was a special case. Let me get through here real quick, and we're going to go because we're out of time. Lots of nastiness. If you're interested in being a BTS in dentistry, you can contact or go through the abdt.us. If you just like teeth and want to get more information, think about becoming a member of the Foundation of Veterinary Dentistry. And you will get a journal every other month now. You can get to the dental forum, which is this September in San Antonio. There's a little bit of a discount when you're a member. Great time, 3 days of dentistry nonstop. Sometimes you get to do really cool stuff when you are involved in veterinary dentistry. This was my biggest patient I ever worked on, a 750-pound tiger named Tank. He had 4 root canals done that day. And I think I'm going to turn it back over to Virginia now.
All right. I do have some questions that have been come in, some good questions. I just want to say, first of all, if you need a race certificate or even a certificate of attendance, go ahead and send your information, as is on the slide here, to webinars@everycat.org. That way, and then I will return one to you within the week. So, and then I had one person ask about slides. We usually don't share the slides, but the recording will be available on our YouTube channel, so you can review it if you need to. Here's a good question, and we talked about this, so you knew this was coming. What does current evidence say about wet versus kibble food in terms of dental health? Yeah.
Dentally, there's not a lot. Okay. Wet food is not necessarily always bad for the teeth, I will tell you that. But the wet food is going to give that cat more moisture, more, especially when we're dealing with kidney issues and things like that. I actually feed mine a mixture. They get canned food in the morning, and then I feed mine Hill's TD because I worked on that diet for 7 years. I know it works well. And it actually squeegees the plaque and things off of the teeth themselves. So, and it's a good renal diet too. So if you have a cat who's a senior, renal issues, it's a great diet for that as well. But yeah, there is, it really depends on who you talk to. And I am not a nutritionist. But my cats have kind of gotten me to let them have some canned food once in a while. I had one cat who wouldn't eat it. So, cats are cats, right? So
Gotta love cats, don't you? Okay. So then this is an interesting question. What positions do you have the patient in? I worked somewhere where they kept the cat in dorsal recumbency for the entirety of everything: rads, charting, cleaning, and oral surgery. Other practices I've seen will continuously flip the cat from right lateral to left lateral. What's your preference and why? And does it make a difference?
actually, I've tried dorsal. I was not a fan. Okay. Um, I actually, when I do cat dental x-rays, I'm going to start with them in sternal. That's what we're intubating them in, leave them in there, get the maxillary done, and then I will put them in dorsal to do the mandibular. It's faster and easier. Okay. I still probably do most of my cleanings in lateral. It's just 30 years, it's hard to break. You know, you can't train an old dog new tricks, guys. I still do my cleanings in lateral. And the only concern I always have about dorsal is the amount of fluid that can get down in the back of their throat, even though they do have a inflated endotracheal tube. But I wasn't comfortable with it. I've worked with some doctors who would do, kind of almost a half dorsal for like a maxillary extraction. But it's really, to me, there is no right or wrong way. What works for you is what you should do. And I know a lot of people get really stressed on turning a cat and flipping them over, during anesthesia, but it's not all that bad for them, actually. I mean, if you're disconnecting the endotracheal tube and you're doing everything you need to for caution, um, it's actually not so bad for their lungs if they're lateral and you switch them to the other side. So that's my preference, but you do you and you do what you're comfortable with. So there is no in my book, there's no hard right or wrong rule way to do it.
We have somebody here who does trap, neuter, release community cats.
Mhm. Okay,
When
thank
they
you.
trap and neuter, they vaccinate, etc., and they lead a pretty healthy life. But in their later years, some of them will develop oral problems. They
Hmm.
can't eat; they're in extreme pain. Any thought? I mean, is there any thoughts on? Is there any kind of well, does the dental community, the veterinary dental community, have any kind of like foundation or someplace like that where some of these places can get some financial help for these older cats?
We we don't we don't really have that necessarily. I am a member, the board member of the Foundation for Veterinary Dentistry, but we do have a program that's called the Make Me Smile program, that we do trainings and help humane societies across the country, um, where we'll come into, a select number of humane societies each year and not only give the entire team dental training, but also help them with the cost of equipment. So there is that option out there. But that is pretty much the only thing, unfortunately, I know of, as far as what we're doing, um, you know, for those kinds of charities. A lot of what we do for our fund, I mean, our money is going to research, and we're trying to find out what is causing these things. What is, what's happening? Why do we have these problems and ways that we can make them better? So, but the Make Me Smile is worth looking into if you're a shelter that you might be able to, you know, apply for that grant.
So that's an application process,
Yeah,
correct?
it's an application process.
Awesome, great. So Make Me Smile Fund. Awesome. Okay. Um, what if a cat suffered from uremic ulcers in the mouth? Do you have any recommendations to support the mouth health other than reducing the uremic toxins?
Not really. I mean, with that, that's not necessarily, I don't think, yeah, I honestly don't really have an answer for that. I'm sorry. I wish we had something that would be more answer to that. I would assume doing some type of keeping that mouth as clean as possible so that they don't become more infected ulcers. But I don't really know for sure. That's a great question. I may have to do some research myself on that one.
That one
Make
kind of
sure they're uric ulcers and not, a stomatitis type situation or something too.
good call. That was
And you always want to biopsy them. When you do have stomatitis, always biopsy.
ooh, this is an interesting question. Have you ever noticed if intact cats, females, have more inflammation of the gingiva compared to altered? She's a breeder of Orientals, and she's noticed that her intact females might have inflamed gingiva, whereas once they're neutered, it goes away to a degree.
That's an interesting theory. I have never had the thought that it could be related to their status. intact or not intact. Um, the the breed itself is susceptible, more susceptible to oral issues than some other breeds are. So that could be playing a role into it as well. But that's a great question. I haven't had that much experience with, working in a general practice. I haven't seen a whole lot of intact females. I'm sorry. I wish I could answer that question for you. So
That is an interesting something
yeah,
that should be
yeah,
like
something to think about. And what was the breed again? Oriental what?
Orientals. She just says
Okay.
Orientals. That's
Orientals. Yeah, I mean, they're more susceptible to periodontal disease and to some of those diseases that I talked about because of a lot of times purebreds tend to be a little bit more susceptible to them. So that could be what's happening is just because of the breed itself. I know we had a rescue that worked with Burmese and every one of those cats had gingival stomatitis. So is it because of a calicivirus that everybody got it or was it breed specific? We don't really know for sure.
that's kind of a good idea for see if we can throw that out for
Yeah.
grant
Somebody to pick
research.
up for a study. Yeah.
She clarifies Oriental short hairs and long hairs. So,
Okay.
all right. Let's see. Closely related to Siamese and Balinese. So yeah,
Yeah.
the
That would explain it. There you go. Yeah. The docleocephalics there. Yep.
um one of the things that you talked about that I think is just a great mention is anytime you have an animal that's sedated or anesthetized, regardless of what it's for, get in there and take a look at the mouth. Um, Whether it's the puppy that's or kitten that's being
Yep.
spayed or neutered, anytime that you've got an opportunity to open that mouth and take a look.
I will also tell you every visit, every time, take a look at the mouth, no
Lift.
matter what they present to your hospital for. Because not only do you find stuff sooner, but it also helps the pet owner understand that dentistry is important. And why do you keep looking at the teeth? Why do you keep doing that? Well, animals who have a healthy mouth, and this is I'm gonna lie, I'm gonna tell you we don't have scientific proof on this. It's all anecdotal. But those of us in the field that have been working with these animals for years know that animals who have a healthy mouth overall will probably have an extra couple of years of life because it isn't going to cause systemic issues. These oral problems can lead to heart, liver, and kidney problems. So if we can keep the mouth healthy, we can a lot of times help that pet live a little bit longer. So
And
every
that's
patient, every time.
yeah, and that's definitely what we're all about is
Yeah.
providing cats with longer, healthier lives.
Yeah.
Next slide. All right, so we are down to the end here. I want to thank Mary. Mary, I've learned so much from you over the years in terms of dentistry, and I can tell you about the time that we had you taught a dental X-rays in the hotel in Minneapolis and
Oh yeah, let's not go back there. Yeah,
escapades
yeah, that
that
was
we had
yeah,
with those
yeah,
models. It
it
was
was yeah.
quite entertaining. So that was
Hmm.
probably one of my funniest times in practice. So yeah. Um, Research saves lives, and the mission of Every Cat Health Foundation is to fund feline specific health studies. So if you're so inclined and you want to help support, please click on the QR code, or you can find a donation button at everycat.org. And one other thing I'd like to remind you, coming up on the 20th, Dr. Vicki Thayer is going to be here to do a webinar called FIP Overview 2025 and beyond. She's going to talk a little bit about where we are with finding additional treatments and also where we are on the outbreak that happened in Cyprus back in 2023. There's been some great strides made there. All right, so let's see, one more. We got last one. This is our thank you for joining us. And
You,
just remember, if you need a CE certificate, email webinars at EveryCat, full name, license number, and state or province, and we'll get those to you within the week. And Mary, thank you. Happy
you're
Pet
welcome.
Dental Month.
Let's see.
Happy Cat Health Month. February is
Yes,
just all kinds of cool things, isn't it?
lots of stuff going on, right? Yeah.
It is. And I look forward to seeing you again, thinking our sponsor, Viticus Western Veterinary Conference. I'll see you at Western. We have a booth there. Does Beyond the Crown have a booth?
No, no, we don't. But I'm going to be running around. I'll be
Okay, well,
everywhere.
stop by and stop by and see me. So yeah.
I will.
Oh, we have a booth there. We've also got 6 hours of feline specific health education. So um, always a pleasure, Mary.
All right. I'll look forward to seeing you. Thank you, everybody, for attending.
Thank
Have a
you.
great day. All right. Bye-bye.